There's the old story of the phoenix that rises from the ashes, and whether that phoenix rises or not depends on each of us. My name is Megan Ranney. I'm a part of the Health Innovators Fellowship, Class 5. I'm an emergency physician, director of the Brown Lifespan Center for Digital Health, and an associate dean at the School of Public Health at Brown University. Life during the COVID-19 pandemic has been unlike anything I've ever experienced before, both as an emergency physician, as a parent and spouse and child, and as a public health leader. I won't lie, my coping skills this year were not at their best. We all deal with grief and trauma in different ways. Honestly, for me, action is one of my biggest forms of coping that helped to manage my stress, my frustration, my anger, my sadness. Felt like every week something new would come up, some new crisis. And I think one of the things that I learned was how to ride that wave of crises and see them not as reflections on me or on my leadership, but rather as opportunities and as a chance to bring in new team members, to not see them all as something that I myself needed to fix. One of my goals over this month is to take a moment to be strategic instead of reactive. We all need to take a step back and consolidate what we've learned and use it as a stepping stone for something better and different. All of our lives in mid-March last year ground to a halt, and that created a space for people to come together and create change. I think one of the biggest thing that stands out about the last year for me was my co-founding and then continuing to lead a nonprofit called Get Us PPE. It was started by a bunch of physicians who came together in the face of the very acute shortages of personal protective equipment. And we grew into an organization of 500 plus volunteers that over the last 15 months has delivered well over 10 million pieces of PPE to those who need it most. We created hope certainly for healthcare professionals who were running out of PPE, but we also created hope for the volunteers who were part of the organization and for the donors who gave money or PPE. It was a sense of something you could do in a face of total loss of control. I learned a lot about the value of coming together as a community to solve these immediate crises, and about the importance of thinking of community as being larger than just your hospital or your professional group, but rather a community writ large. One of the qualities of leadership that I don't think I'd really realized that I had was the ability to be a clear communicator. If you can't communicate clearly about all of those aspects, the whole thing falls apart. You don't have alignment between volunteers. You don't have people standing up willing to donate. And you certainly don't have buy-in of the communities that you're trying to help if you can't communicate clearly with them. There are so many things that I think have become possible for us thanks to this horrific past year, things which I could have only dreamed of before. And my hope and fear is that we will or won't take advantage of this possibility that has opened up. You know, there's the old story of the phoenix that rises from the ashes, and whether that phoenix rises or not depends on each of us. I frequently say that I feel that the COVID-19 pandemic ripped the band-aids off of all of the problems with society that were already there. Structural racism, overcrowding of emergency departments, insufficient funding of our public health infrastructure, economic inequities, misinformation. Those were all problems that existed prior to COVID-19, but got amplified and were impossible to ignore. We now have a choice. Do we move forwards and invest in public health, invest in truth-telling, invest in creating community-based innovation and action, invest in fighting structural racism and putting real changes in place to create a pipeline of opportunity for folks that have been marginalized for the last 250 years? Or do we get through the pandemic, close our eyes and pretend it never happened and let things go back to the way that they were? I think there's a world of possibility there if we choose to take it. It's on our leaders, but it is also on each of us. And if I have learned nothing else during this pandemic, it is the power of community to come together and not just demand change, but to create it when no one else will.